All right, good afternoon, everybody. Welcome to our March 24th, 2020 press briefing. I'm here this afternoon with my fellow commissioners, Commissioner Ken Lawrence and Commissioner Gayle, along with Dr. Brenda Weiss, the administrator for our Office of Public Health, and Dr. Alvin Wong, our Regional EMS Director. So we continue to have a very rapidly evolving situation here in Montgomery County with COVID-19, and I will do my best to answer all of your questions, even though I may not have complete information for all of them. Since our March 23rd press release, we have 23 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 159. These new positive individuals are from 17 municipalities, none of which are reporting their first cases. These individuals range in age from 22 years old to 86 years old. And as always, you can see our county map for the geographic location of our cases at www.montcopa.org/COVID-19. The age brackets for these 23 individuals are as follows. There are 3 people between the age of 20 and 29, 6 people between the age of 30 and 39, 2 people between the age of 40 and 49, 6 people between the age of 50 and 59, 3 people between the age of 60 and 69, 1 person between the age of 70 and 79, and 2 between the age of 80 and 89. The gender breakdown are 12 females and 11 males. 2 are hospitalized, 9 are not hospitalized, and 12 is unknown at this time. So as we've been doing, we've been trying to help people understand why social distancing and staying at home is so critically important to reducing the total number of cases of COVID-19 here in Montgomery County. So today we want to share this graphic with you, and I want to thank Dr. Robert Steiner, who's an assistant professor of medicine at the University of California, San Diego, and Gary Warshaw, the art director, for allowing us to use their graphic today. We thought it really made a nice explanation. So you can see in the top row that without social distancing, 1 person with COVID-19 is estimated to infect 2.5 people. So over a 30-day period, that 1 person with no social mitigation or social distancing measures could potentially infect 406 people. If we can reduce that exposure by 50%, so now that 1 person infects 1.25 people, by 30 days, there's only been a total of 15 people infected. And if we can reduce that exposure by 75%, then 1 person doesn't even infect a whole person over a 5-day period. And so by 30 days, only 2.5 people are infected. So you can see what a dramatic difference it can make right here in our community if we all just stay home unless absolutely necessary. I want to continue to announce that our community-based testing site continues to run. It has been up and running since Friday. Things are going very smoothly there. I want to again thank Temple Ambler for allowing us to use their parking lot, Upper Dublin Township for a whole variety of support they've given to us, the Pennsylvania National Guard Medical Unit, which is actually doing the testing, and numerous county departments that are assisting. The site remains open by appointments to individuals meeting the criteria that I will review in a moment. The site will be open from 10 a.m. to 6 p.m. daily as testing supplies allow. I'm very pleased to announce that as of 1 p.m. today, we have the capacity to somewhat relax our testing criteria. Individuals meeting 1 or more of the following 5 criteria will be welcomed for testing. And here's the new piece. Persons of any age and with symptoms of sudden illness, such as fever or cough or shortness of breath or loss of smell or taste, and also including gastrointestinal symptoms, such as nausea or vomiting or diarrhea, whether or not they have a fever, will be welcome for testing. And then additionally, we are still welcoming first responders, law enforcement, fire, EMS, or dispatchers who have concern for exposure to a patient with suspected COVID-19 or symptoms of any acute illness with or without a fever. We're also welcoming healthcare workers who provide direct patient care and have concern that they were exposed to a patient with a suspected COVID-19 or have symptoms of any acute illness with or without fever. And anyone with known or suspected direct contact with someone with COVID-19, and anyone who's been recommended by their doctor or healthcare provider to be tested. So we welcome all of those individuals. Due to the still limited number of tests available, tests will be reserved for the higher risk categories of individuals that I just described. Generally healthy individuals who have mild symptoms and no underlying medical conditions should remain at home and continue self-isolation. You do not need to be tested at this time. Criteria may be further relaxed or enhanced based on the future availability of tests. We do still want you to register to be tested. This is part of how we can track to make sure that you get your test results back. You can make an appointment online at montcopa.org/COVID-19. There's a button at the top that says community testing information. Just click on that and you can sign up. That link is also on all of our official government social media accounts. And if you don't have an email address or you don't have good internet access, you can call 610-631-3000 between the hours of 8 a.m. and 8 p.m. to register for a testing appointment. If the phone is busy when you call, please just wait a few minutes and call back. The one thing we don't want you to do is to call 911 for a testing appointment. Please do not call 911 for a testing appointment. As I hope you all know by now, yesterday Governor Wolf announced a 2-week stay-at-home order for Montgomery County along with our neighboring counties that began at 8 p.m. last night. I support this order and strongly encourage the governor to issue this order. I believe that staying home, except for essential work or trips, is the most important thing that we can do as a county to slow the spread of COVID-19 and protect those that are most vulnerable to this disease. The elderly, those with serious underlying medical conditions, and those that are immunocompromised. Staying at home does this, and when we do this, we protect our first responders, we protect our hospital and healthcare workers, and other critical workforce from being overwhelmed with COVID-19. Staying at home is how we together will flatten this curve. So, we want people to stay at home or their other place of residence, except under limited circumstances. All individuals currently living within Montgomery County are ordered to stay at home at their home or place of residence. All life-sustaining businesses and operations are encouraged to remain open. Essential businesses and operations must comply with social distancing requirements. Non-essential businesses should be closed. The list of businesses considered essential or non-essential can be found at dced.pa.gov. That's D like David, C like cat, E like elephant, D like David.pa.gov. And I just want to take a moment for everyone who has now been at home, some of you for several days now, and just want to check in and make sure that you are taking steps to take care of yourself during this very uncertain and stressful time. I want to remind everybody that it is okay to not be okay. The goal here is to maintain social distance, but not social isolation. So you can move, get out, walk, bike, jog, stretch at home if that works best for you. There are also many virtual meetups and parties and support groups on social media right now. So figure out what your friends are doing and pick a time and everybody get online together. Everyone needs to get sleep as much as possible. Try to get at least 8 hours of sleep every night if you can, but at the very least try to maintain a regular sleep schedule. And then try to eat healthy. This is not a time to eat all the junk food that's in your house. Do your best to get some fresh fruit or vegetables, even if they're frozen. Just try to maintain a good, balanced, nutritional diet. That will definitely make it easier to feel better. And there's nothing wrong at all with making your dinner and getting on FaceTime and talking to a friend while you're eating. You can pretend you're out to dinner together. You're just doing that in your own homes. And then don't hesitate to take a break. If you're feeling anxious about all the media coverage and social media postings about COVID-19, schedule some time every day to take a break from it. Hopefully it won't be during this press briefing, but that's okay too. So whatever you do though, do make sure that you take some time to take a break, get outside, breathe some fresh air. That is still okay as long as you're keeping social distance. And with that, I am going to turn over to Commissioner Ken Lawrence for some additional updates.
Thank you. We've been getting a lot of inquiries from the public about whether volunteering is allowed now that there's a stay-at-home order in place. And it absolutely is. As part of Governor Wolf's stay-at-home order, which took effect at 8 p.m. last night, he gave specific guidelines regarding volunteering. Individuals may leave their residence to get necessary services or supplies for themselves, their family, or household members, or as part of a volunteer effort. You will not be stopped or cited by law enforcement for any of these efforts. But as Val said, please make sure you are using the same safe practices such as social distancing, washing your hands, and staying at home if you're sick or have been directly exposed to someone who has tested positive for COVID-19. But we've been providing a lot of volunteer opportunities for people. We're very pleased that our citizens have stepped up. You may continue with those efforts. We've also received requests from medical professionals who want to help. The Montgomery County Medical Reserve Corps is part of a national network of medical and non-medical volunteers organized to enhance the county's emergency preparedness efforts. If you're a medical professional who would like to help, please email mrc@montcopa.org. That's mrc@montcopa.org. And Val mentioned dinner. Today is the Great American Takeout. Restaurants in the area are asking for our help to support the industry by joining the Great American Takeout and supporting them throughout the COVID-19 emergency. Many of them are offering special deals to encourage residents to pick up or get delivery from their favorite restaurants. So there's a link on our website, the Montco COVID-19 site at www.montcopa.org/COVID-19. It has a list of restaurants in the area who are offering takeout or delivery services. You can get your food and then you can go home and FaceTime with someone else. I'm also going to share some fun family activities that people can do when they're stay at home. I have 2 teenage sons, so if they are watching, I want to ensure them that I'm not going to do any of these with them. First, create a schedule. Have a routine for the day. Some people are sleeping in, and during that, let's try to keep a regular time to get up each day. You can work out together or have an indoor dance party. You can have a backyard nature or scavenger hunt or build an indoor obstacle course. You can have a movie night with popcorn and the lights out and turn off your phones if you're going to do that. Our local library, our Montgomery County Library, you can download digital content from there. You can read stories, try a new recipe or play games together, or have a Lego challenge. And something that my neighborhood did this past weekend, I know other neighborhoods are doing as well, is place a rainbow or teddy bear in your front window or the yard for neighborhood kids to see, and they can count how many there are when they're out for walks. We have a whole street that's a rainbow, and I've seen some teddy bears as well. So, as we've said, you are encouraged to go outside. You are allowed to go outside, practice social distance there, and order out from your favorite restaurant tonight. And with that, I'll turn it over to Commissioner Gayle.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gayle. I'd like to begin my remarks today by thanking all the residents of Montgomery County for their cooperation as we combat this pandemic. And we have data and statistics that prove there's been a great amount of cooperation with the residents of Montgomery County. One of them being the level of communication. The hotline, the email address, and the phone number for the COVID-19 hotline has been utilized by the residents of Montgomery County. and they're referring to those forms of communication instead of emergency 911. And we have a graphic here on this screen where it shows the amount of police incident calls from February 1st of this year to yesterday, which was March 23rd. And as you see, we have approximately 2,000, actually over 2,000 police-related incident calls a day here in Montgomery County. Last week, I gave a special thank you and shout out to the telecommunicators that work 365 days a year, 24/7, fielding these emergency calls. And if you put yourself in their shoes, the calls they're dealing with are not pleasant. There's a lot of times chaos on the other line and obviously an emergency on the other line. So they're working very hard year-round, fielding over 2,000 calls approximately a day. So our first case of COVID-19 in Montgomery County was March 7th. The highest number of police-related incident calls was March 9th, 2 days later, when this was actually kicking in and people were stressed over it. We received the most 911 related calls at approximately 2,300 calls. This number of phone calls has drastically declined since. Yesterday was one of our lowest points of emergency phone calls at approximately 1,200 calls. So that's about 1,000 in a decrease of the amount of 911 emergency calls that our telecommunicators are fielding. So that's a credit to the residents of Montgomery County that are utilizing the hotline and realizing that the telecommunicators are here for emergency only, not for testing cases or anything similar to that. I'd also like to share with you what we're doing to help the taxpayers in Montgomery County, as well as the workforce here in Montgomery County and businesses. Last week, President Trump and Treasury Secretary Steven Mnuchin announced that the deadline for filing federal taxes will move from April 15th to July 15th. Since then, I've been asked by many residents what the status is on the state personal income tax returns. The deadline for taxpayers to file their 2019 Pennsylvania personal income tax returns is also extended to July 15th, 2020. This means that taxpayers will have an additional 90 days to file from the original deadline of April 15th. Last week, I announced my efforts to help families and taxpayers adversely impacted by the coronavirus by working to extend the property tax filing deadlines in Montgomery County. This is an ongoing effort, and communication with the 62 municipalities and tax collectors across the county is underway. Given the potential negative financial impact on families are facing because of this pandemic, and also the legal requirement that tax collectors offer in-person office hours prior to certain deadlines related to the tax payments, we are asking our municipal partners to consider an extension of the discount period for payment of real estate taxes. We have received commitments from the largest financial institutions that they will deposit escrowed funds as they normally would and will not change the payment date. So we thank you for the cooperation of our financial institutions that cooperate through the escrow payments. The county recognizes that this decision must ultimately be made by our municipal partners, and we respectfully recommend an extension of at least 4 weeks, with our preferred option being that all municipalities jointly extend through May 31st, 2020. As this crisis is likely to persist for some time, we believe municipalities should also begin consideration of an extension of the face value period as well, and the face value is the full property tax amount. While we acknowledge this will put additional strain on budgets that are no doubt feeling the stress of the current emergency, we feel that this extension is in the best interest of all our residents. In addition to property tax extension, later this week we will announce resources available to assist the business community during this difficult time. Our Montgomery County Commerce Department will be providing information on resources available through the Small Business Administration. Small businesses that have lost revenue as a result of the coronavirus can apply for low interest rate loans through the Small Business Administration Loan Program. These loans can be used to pay payroll, fixed debts, accounts payable, and other bills. So we will have more to update you regarding that. And please continue to visit our county's COVID-19 data hub for updates, and we will be releasing more specifics later this week. Thank you very much.
So with that, just again want to thank everybody for what is going on in our community, which is actually not a lot, which is great. That's what we want to see. People are really heeding the call to stay home. When I drove here this morning, the streets were as empty as I've seen, and that's good news. We know it's incredibly difficult on our local businesses, and so if you can possibly support particularly the restaurants that are still working, please do that in any way that you can. But most importantly, we want to make sure that we get a situation that looks like this bottom line, not the top line, here in Montgomery County. And with that, I'll take questions.
Is there any way to tell if that's working when it's working, or is that just a big picture thing? You mentioned that with more testing, you're obviously going to get more positives. So is there any way to kind of take the two apart and look at it while it's happening?
There is. I think once we have more test results back, particularly from our community-based testing site, we're probably a little over 1,000 tests done there now, but we don't have a lot of those results back. So once we have all those results back, plus the results that we already have and the negatives that we know about, it'll help us try to actually figure that out. Right now, we don't have quite enough data to know with certainty, but I think just based on what we're seeing with things like the reduction in police calls, how empty the streets are now, we're working on some other data that we may be able to present tomorrow. I do think that we are seeing a reduction, but we'll know in time.
Have you gotten any of the test results back from the testing site in Upper Dublin?
Dr. Montgomery, just a handful, right?
We do have a fair number of tests back, but they're not all back yet now.
Yeah.
So
I mean,
if it's
small
1,000 tests,
Right.
we could
Correct.
see a
We
big
could,
jump.
absolutely. We could, and so that's why we've been talking about that as we do many, many more tests, we will expect to see more positive individuals. And that will give us better data to try to understand where exactly we are here in Montgomery County.
But also could frustrate people who have spent a week or two in isolation and feel like it's not working. So I'm just
Yeah.
trying to explain how
Yeah.
you look at an increase, a possible increase with
Exactly.
1,000 tests out there and not discourage people or get them frustrated because it's not working, so we'll go out kind of thing.
So no one should be discouraged. In fact, just the opposite. We're cautiously hopeful that we've been able to put social mitigation strategies into place, which we started the very first week that we got notified that we had presumptive positives here in Montgomery County. And people have been heeding those calls. So I think when you look at where we are today with 159, I'm sorry, I've lost track of what that number is. Yeah, 159 cases today compared to where a place like New York City is. Obviously, much larger population there, but also a much higher percentage of people with disease. We're hoping that we're going to come out of this okay and keep that curve relatively flat compared to a lot of other places. But again, I don't have the data to show that.
Where are
Yes.
you on the donation issue, like the masks and things that you had asked for on Friday? It looked like from monitoring your social media, you got some good donations.
You know, the
and stuff.
community has been amazing in their willingness to donate masks. We've gotten many, many boxes of masks. And I want to actually just address a little bit about what's going on with personal protective equipment between the county and hospitals. So the hospitals have a well-established pathway to communicate any unmet needs for something like personal protective equipment. And the hospitals go to the Hospital and Health System Association of Pennsylvania with any unmet needs. If HAP, that's their acronym, HAP, is not able to fulfill those needs from their sources, then they will reach out here to the Emergency Operations Center, talk to our director, Tom Sullivan, and convey that they have an unmet need. And then the county can try to work with them to help fill that need. Our first responsibility here at the county is for all of the first responders across the county, our 50 municipal police departments, our paramedics, firefighters, other first responders. So our first responsibility is to them, but we also have made requests from the Strategic National Stockpile for masks. And this past weekend, there was a delivery from Montgomery County's allocation of masks to every hospital in the county. So we are working very closely with our hospitals across the county to make sure that they are able to get what they need. I spoke between Dr. Weiss and myself. We touched base personally with each hospital in the county this morning, and the hospitals are feeling okay. They are taking it day by day. They have the supplies that they need for the short term. We are all working to get more supplies in for the long term. We don't know how long this is going to last, so we are making plans for this lasting for many weeks to come so we don't come up short. But so far, so good. People are conserving personal protective equipment. The CDC has very clear guidelines for how healthcare facilities can conserve PPE during a pandemic, and I believe most, if not all, of our hospitals are following those guidelines, but they all say, at least today and for the next short interval, they are okay. They believe they have what they need.
You mentioned when you talk about the community testing site, that it will stay open 10 to 6 as long as supplies last. Are supplies holding out, or is there any indication that that may come into play?
We don't have a firm answer on that yet. We are still within our initial supply allotment. What we don't have a clear answer to yet is whether or not we're going to get a second allotment of tests.
And if you didn't, how much longer do you think on average?
It just depends on how many people show up each day. So I'll have a clearer sense of that probably in 2 days of where we're at.
And how far out, if somebody goes on right now and they make an appointment, how far out are they getting scheduled?
Well, right now, we could still see some people today. So if people wanted, with these, if they heard these expanded guidelines and they want to hop on or make the call right now, we're open till 6, and I believe we do still have appointments available this afternoon. So people are absolutely welcome to do that. Teresa, do you have anything?
Is the turnaround on testing still the 4 to 6 days?
The turnaround is variable. We've gotten some number of tests back fairly quickly, but it seems like for the most part, we're in that 4 to 6 day range.
And no further update on recovery or release?
We don't get that data. I'm sorry. I don't know that we'll ever get that data, so.
Okay, and is that a challenge when you talk about positives and you talk about cases, that number's not going down? Is that a challenge for you as you deal with this, or is that, you know what I mean, like the active cases aren't changing?
True, right. So what we're reporting, and that's, I think, important for the public to understand, is that when I say now that we have 159 total positive cases, that's just our total from Saturday, March 7th, I think was the date, until today. That doesn't mean that we have 159 people that are still ill. It's quite possible that in those early days, some of those folks have recovered and are doing fine. As we've reported, we've had, unfortunately, 1 loss of life to the disease, but I have not been told of any additional loss of life. Okay. All right, great. Thanks. And tomorrow at 3, unless you hear differently from us. Thank you.
A distillery, I believe, provided sanitizer. Is that a Lansdowne
Yeah, I think
distillery?
Talk about that tomorrow.
we're going to do a whole update on that tomorrow. Yeah. All right.